part of the president of our central banking series and the College of Central Bankers. So he's a really cool guy. And I adore him. And then we have Annette and Rayna, who are both in the healthcare industry. I'll let them tell you a little bit more about themselves because they are very bright people who have been on the forefront of what is happening in the healthcare industry. Do you all think of it as pre-COVID, post-COVID, or life before, life after? I don't know how you think of it.
I like to say we're at a post-COVID reset.
Post-COVID reset. So Peter has some excellent questions prepared, and the ladies are ready for it. So without further ado, it's your show, Peter.
Thank you, Lisa. So is it working?
Yes.
All right, good. So with this panel, I think we're going to pivot just a teeny little bit to focus more on the social aspects of what we're doing here today and what we're learning about. So our title of this segment is Social Impacts and Integration of ESG in Healthcare. And I wanted to really start today with a parable, which is not mine, but think about it as perhaps we go through the next half hour, 45 minutes, hour. It's actually from David Foster Wallace, an American author, now deceased. And he tells this little story, actually at the graduation class of Kenyon University in 2005. He was the speaker. And he says this. He says there are these two fishes in the ocean swimming along, two young fish. And they swim by an older fish, a larger fish. And the older, larger fish says to the two younger fish, "How's the water?" And the two younger fish say, "What water?" Now, not exactly clear of how this is related to what we're going to hear today, but I promise that it is related. And we're going to try to figure it out in some of the answers and some of the discussions we hear today. So the way I thought we would do this, and the way we agreed, is that each of our presenters would spend a few minutes, maybe 10 or 15 or so, on their individual presentations. Then we do have some folks who have submitted questions, but your questions are very important to us as well, so we hope to get to that question and answer session. So I think the backgrounds of our speakers and presenters today are just distinguished in terms of their expertise in this particular area and their expertise in healthcare. But if you think about it, really what we're talking about today and has application, at least in my opinion, is to many nonprofits, whether it's healthcare or other types of organizations. And healthcare is just illustrative of some of the principles. So without more ado, I don't know which of you would like to proceed.
I think I'm supposed to go.
Okay, well then you do to it, and I'll love to learn from you. Thank you.
Well, good afternoon, everyone. It's a pleasure to be here, and I want to thank Sue Lerman, my colleague from Rowan University, for inviting me. And it's great to be on this panel with Peter and Rayna as well, and I hope to learn things. I never know whether it's best to go before lunch or immediately after lunch. I think that sometimes that's a problem. So just bear with me, and I'll go ahead and set up my first slide. So I've spent my entire career in healthcare, and I've delivered direct patient care for most of my career. I've been an administrative officer of a health system, and more recently, for the past 12 years, I've been involved in the rare and unique opportunity of starting a new medical school, which is under the auspices of Rowan University, Cooper Medical School of Rowan University. And when I think about the context of that, I think about how are we best preparing our future healthcare providers and leaders, not for the practice of medicine that we currently have, but for the practice of medicine that they will have, and that is very much tied into ESG. So I'm going to concentrate on education in this, but also talk a little bit about healthcare in general and all three aspects. Now, my discipline within medicine is infectious diseases. So no talk in the pandemic era would be complete without a mention of COVID. So within the context of COVID, folks talk about the twin-demics, not only the COVID pandemic, but also our reckoning nationally with racism as another public health crisis that we're facing. And this becomes very important. We've seen health disparities within the context of COVID, but we've also seen health disparities that have come to light in medicine in general, and those need to be addressed. So our current challenges are listed on this slide within the context of healthcare. Workforce issues, including preparing a diverse workforce. This is going to be essential as we see the demographics of the United States changing. It's very important that we have providers who, if they can't look like the patients they care for, have the cultural humility and the cultural competence to be able to care for diverse populations, including populations that didn't grow up with the same understanding of health and disease that we have in the United States. Quality of patient safety. This is very important. This is crucial to the success of any health system and important to our patients. Preparation for the next outbreak, epidemic, or pandemic. And it's not going to be a matter of whether we will have another pandemic, it's an issue of when this will happen. And that also ties to climate change, how we travel, how we live, our interface with animals, and the climate change driving changes in vectors. As we see vectors, yes, you're nodding, absolutely. Leveraging technology. You know, during the pandemic, we were able to effectively, as educational institutions, Dr. Lerman faced the same thing, leverage our technology to continue to deliver our education to our students. Access and affordability is important. It's important in education, but certainly within the arena of healthcare. And the third topic, a topic near and dear to our heart because we have a Center for Humanism at my medical school, is restoring compassion. In our techno-driven age, that tends to sometimes take the back seat. Providers sometimes are so engaged in the task at hand, completing the patient encounter, entering the information in the electronic medical record, that sometimes they forget that there's a human being sitting across from them who has needs beyond perhaps you writing a prescription for them. So this slide, I think, is a nice summary of how environmental, social, and governance issues all come into play. And all of these topics are certainly applicable to healthcare and medical education. I put in this slide to remind us of a few environmental factors. And you can see here that in 2014, the U.S. healthcare industry produced an estimated 480 million metric tons of carbon dioxide, or about 8% of our country's total emissions, just in the aspect of delivering care, which is amazing. So certainly health systems will need, and some are already doing this, are taking actions to cut their carbon footprint You see the estimates of deaths from air pollution, about 7 million, costs by 2032 to $4 billion, deaths from mainly infectious disease, malnutrition, malaria, 250,000. And the bottom shows that those vector-borne diseases rising within our continent, moving up from areas south of us where they're pretty much confined now. I put in this example of air pollution, and this is an area where we think about environmental changes, and we also think about environmental racism as well, where the numbers of young people in marginalized communities across our country suffer from the effects of air pollution with increased rates of asthma. Healthcare in our environment, this is some research from Cornell that showed that in general, healthcare facilities around the world create about 7.5 pounds per person of PPE waste, personal protective equipment. And now everybody knows about PPE because of the pandemic. And you can see sort of this mountain on the left side of masks and gowns and gloves. And you could think even about individual mask use as average citizens, not even involved in healthcare. Think of all the masks that you used and threw away and disposed of during this time. And then you see some PPE up on the shore there, running up on the shore. And in fact, the interesting thing, and I've spent my life wearing personal protective equipment. The start of the pandemic, we didn't even know if the PPE would actually work, quite frankly. You know, it was frightening for healthcare providers to think about that. And so it was sort of the shotgun approach where everybody was wearing everything. The gown, the gloves, the mask, the goggles, the face shield, etc. And now there's been a thought, well, what do we actually need to wear? How could we cut this back? Healthcare pollution, we gave you some numbers about that. But you can see here all the components of it. Supply chain is big with this, the actual delivery of care, travel, pharmaceuticals. The pharmaceutical industry does have a major role to play. Some companies are working on this. The use of water within the pharmaceutical industry is a big topic of conversation. And then is U.S. healthcare environmentally sustainable? You know, many talk about our U.S. healthcare system as not being sustainable, mainly because of cost and issues of quality. You know, our price point is high, our quality is not as good as other countries. But are we environmentally sustainable with what we're producing with regard to waste? And here are some of the considerations here. We talk about healthcare reform, initiatives that many individual systems are taking on now to become green buildings, failure of the movement to offer healthcare an effective paradigm for our sustainability. The role of preventative medicine, it's always better to prevent something than to have to treat it. And then allocation, triage, and of course bioethical considerations. Opportunities for green healthcare initiatives revolve not only with patients but also with providers. I put patients on here because frequently the patients now are better consumers. They'll come forward and they'll question. They're more educated, they're aware of some of these issues, and some of them may even ask about alternative therapies. Physicians, and I think you're going to see this with the younger generation, you know, some folks bemoan the fact, they'll say, you know, why can't they be as good as we were? Are they as good? And my response is that they are as good, they're a little different, and they have much greater social consciousness than, say, older generations of providers. You know, any initiative that we take in later on during the panel, I'll talk about some of the things that our students have been involved in. when I was a 20-something-year-old medical student, I wasn't able to engage at that level. You know, the way if there's something that needs to be done, advocacy for patients, work within the social arena, our students just jump on the bandwagon. You don't have to ask them twice. Social, I put in some slides about this. Now, I think this is an area, maybe just because of the selective process where healthcare and medical education are ahead of other industries. It's certainly the diversity, equity, inclusion realm. There's much more work to be done. Service to the community. I'll talk a little bit later on about some of the service projects that our students have been in supporting the Camden community. Gender, pay parity issues, engagement across the board. Patients to board members, to the community, to business partners. Access, quality, and safety, and of course, protecting information. Key trends, and I think that all of these will contribute and hopefully lead to progress within ESG, artificial intelligence, 3D printing, cybersecurity, telehealth, wearable devices, and improving access to medications and vaccines in underserved areas and developing countries. I put in a slide about governance. Certainly compliance may drive changes, including government, federally sanctioned compliance. But it's always best to be on board with movements before they're either sanctioned or demanded by the government. The need for board diversity, shared governance, mergers and acquisitions within healthcare, some good, some bad, and then this whole aspect of for-profit hospitals, healthcare systems, and medical schools. Something new, there are several of them, including some very large groups, Hospital Corporation of America, and others that are in this business, and then also big box pharmacies, going beyond filling your prescription or selling you cosmetics. They are getting involved in the healthcare industry. So I'd like to thank you, took you on a little whirlwind tour there of where I see this going. And this is my contact information here. If anyone would like to communicate, I would love to hear from you. Thank you.
Okay, I'm testing my mic, but I'm wearing. Is it okay back? Yeah. Thank you, Dr. Annette. My name is Dr. Rayna Letourneau. I am a nurse, and I'm here to talk to you about ESG and how nursing aligns with these factors in this framework. I will give you a little bit of my history so you know where I'm coming from and kind of what's my why. Why do I do the work that I do, and why am I here today, fortunate enough to talk to all of you. I will tell you that when I started nursing about 20 years ago, I was a baccalaureate prepared nurse. I graduated from the University of Rhode Island in 2001. As a clinical trained nurse, I practiced in the emergency department. It was my dream job. I always wanted to be an ER nurse at that time. People told me I wasn't going to be a good ER nurse. New nurses don't belong in that specialty area. You need more experience to be able to go there and do that type of work. And even my faculty members begged me, please don't go into an emergency department. And I thought, well, that doesn't make sense. Why wouldn't I be supportive? You know, if somebody is passionate and wants to make a difference, what resources can that person have, or what do they need to be successful? And so when I reflect now, obviously I didn't know then, but when I reflect now, I see that's why I'm doing this work, because I want to be able to support our nursing workforce. So fast forward a little bit, and as I was working in the emergency room, and I will tell you that I was very good at what I did, and I loved it, I started being the person who was the go-to, the trainer for new hires. And I loved that teaching, but I also saw that I wanted to have an impact in some policy and procedures, and I needed to go back to school. So I went back for a master's in nursing administration and graduated in 2008 from, again, University of Rhode Island. I started working in the education department and really making changes and helping the onboarding of new nurses, making sure they're supported in the environments of which they wanted to work. And I realized, again, there was so much more that I needed to be able to do. So I went back to school for a doctorate degree. I went to University of Massachusetts Dartmouth and earned a PhD in nursing education in 2011. At the time that I went to UMass Dartmouth, I also started working full-time in higher education as an instructor and teaching the next generation of nurses. So that's kind of how I got into higher education. My research focuses on workforce development and quality and safety. So that's a little bit about who I am. Just before the pandemic, at the end of the summer in 2019, I moved from New England to Florida. So I'm one of those who, I'm sorry, are making the bottom part of the maps more red, and but I love it and I love everything there. So I started working at the University of South Florida, fortunate enough to be given some opportunities to really hone in on my scholarship and research related to workforce development and quality and safety. So I am there. Oops. So I do bring you greetings from Florida. University of South Florida is actually not in South Florida. We're in the West Central region. So here, if you break down Florida into our different regions, you'll see the yellow star shows you West Central. It is Tampa Bay. We were prepared for the worst with Ian, and we were spared, but our South Floridian colleagues were not so lucky. And I just show you that because I think if you're not familiar with Florida and you hear University of South Florida, you may just automatically think Miami. But we are Tampa Bay, otherwise known as Champa Bay for the sports enthusiasts. Sorry, had to throw that in there. Some points of pride for the College of Nursing at the University of South Florida. We do have a diverse student population. We have undergraduate and graduate programs. We pride ourselves on our certification, our licensure certification rates. So much higher than the national averages and our state averages. And you'll see here our enrollment numbers in both our undergraduate and graduate program, almost 2,000 students. So very exciting stuff happening at University of South Florida's College of Nursing. And just this fiscal year, July 1, 2022, the University of South Florida was awarded our state's Center for Nursing. So the Florida Center for Nursing is now housed at University of South Florida. Per our statute, our goals are to measure the supply and the demand of the nursing workforce and come up with our state strategic plan as to how to correct our imbalances. And then also promote recognition and reward activities for our nursing workforce. And I'm going to talk to you about why that's so important. I tell you about the Florida Center for Nursing because I am honored to be the interim executive director of this center now that it's housed at the University of South Florida. So some of the things that we're doing within that Florida Center for Nursing is really collecting and analyzing the data related to the nursing workforce and making sure that those that are making decisions about our workforce and those that are making policy are able to make data-driven decisions. And I think everybody here will understand the importance of making sure that we look at what our best practices, what does evidence show, and then we're able to make those decisions. The Florida Center for Nursing, of course, we focus on our state workforce and take deep dives into the region and the different settings, but we also are very active in the National Forum. And so the National Forum of State Nursing Workforce Centers is our umbrella agency. We have 39 state nursing workforce centers that participate in the National Forum. And so I wanted to share that with you because Florida is very active at the national level and helping with their leadership, research, and policy. So now to get to the point of why you all are here today. What does nursing have to do with ESG? And I want to explain to you and give you some examples of how nursing is a profession that absolutely follows the ESG guide, the principles of ESG, and looking at the changing conditions and shifts in ESG and how nursing responds to them. So starting with environment, and I do want to look at a couple notes to make sure that I don't get too off track. But yeah, when we're looking at the environment, and there's a lot of information this morning and before lunch about climate change, renewable energy, reducing carbon emissions, pollution, reducing waste, and Dr. Annette was really showing us the amount of medical waste that we acquire. I really want to look at how nurses are leading in this area. We truly are leaders on climate, knowing that climate change is really imposing serious threat on the health of our communities and the health of our population. So for the past 20 years, nurses have been voted, have been identified as the most trusted profession by Gallup poll. And with that, that gives us really the credibility to be able to promote health and wellness, to provide education to our populations, and to really have a great impact. So we know that the populations most at risk include all vulnerable populations, the children, elderly, low income, and minorities. So nurses have direct access to these, and we can focus and plan our interventions to make sure that we're able to provide the care, the education, and meet the needs of those populations. At the very top picture here, there's it's a collection of logos from different nursing associations, because our nursing professional associations come together as collaboratives and focus on how we are addressing climate change and the impact on health and wellness. So looking at our social factors, diversity and inclusion, you'll see here in this top picture, it looks like a diverse nursing workforce, but we have a lot of work to do. This is one of the priorities in nursing is, like Dr. Annette said, patients want to be cared for by providers that look like them or understand them. And we have work to do in nursing to be able to diversify gender, race, and ethnicity. So that is one of our priorities. We also focus on anti-discrimination, anti-bullying. We also, in full transparency, have a lot of work to do within our own profession related to discrimination and bullying. And it is some of our priorities. Also within the S category, we focus and do a lot of work with data privacy. And I'm sure if I say HIPAA, it's not the first time you've heard the term, but it's really one of the most important things that nurses are able to impact. And then governance. Sure. With governance, I wanted to touch upon risk mitigation. And, in the earlier sessions today, we heard about risk mitigation related to finances. And with nursing, we may not be looking at financial risk mitigation, but we kind of are in an indirect way, because when we're focusing on quality care and patient safety in the healthcare settings, there are definitely financial implications for the healthcare organization. So it's important to notice that. We also, within governance, focus on accountability, decision-making, and leadership. What we want is for nurses to have a voice in the decision-making. We want nurses on boards, and here you see a picture or a logo for the Nurses on Boards Coalition. So again, another initiative that we're really prioritizing in our workforce to make sure that nurses have training, confidence, and are qualified to serve on boards, because we need the decision-making and the perceptions of nursing in these settings. So I could not make mention to our sustainable development goals, and of all of the 17 goals, we can make an argument on how nursing impacts or plays a part in every single one, because they're all related to the health and the wellness of our population. So now talking about financial opportunities in nursing. what are some innovations or initiatives or assets in which others would want to invest and be able to promote nurses, because the work that we're doing is ultimately going to improve the lives of others. So, and talking about target investments for healthcare organizations. So then I would like to show you 2 exemplars of how you may invest in nursing, how we can provide programming that focuses on recruitment and retention strategies and the well-being of nursing. And the first program I would like to talk to you about is the Frontline Nursing Program. And some of you are familiar with this already, so pardon me if it's repetitive. But the Frontline Nursing Program, because of philanthropic support, we were able to, at the University of South Florida, put together a continuing education program for nurses. And we put this together in 2020. So I ask you to think back where Dr. Annette was talking about we didn't have the knowledge, we didn't know what PPE was necessary and people just put everything on. And there were also institutions at that time that didn't have access to the PPE, and the nurses were being asked to wear garbage bags to try and protect themselves. We just didn't have the knowledge. Nurses were getting sick. Nurses were afraid to go to work. Nurses were leaving the profession. And so we had an opportunity to offer some intervention to them. So we put together a continuing education program for them. It was an online asynchronous, so nurses who were working around the clock and every day, whenever they had the opportunity, they would be able to access it. What you see on this slide is, I know it's small, I don't expect you to read it, but I just wanted to show you that the outcomes of this program were disseminated at professional conferences via poster presentation and through a peer-reviewed manuscript published in the Journal of Continuing Education in Nursing. And I'll just tell you that because of this program, we had more than 1,000 nurses participate, and we were able to issue 995 continuing education units. This program gave nurses education and skills in resiliency and empowerment. So more than just the pathophysiology about COVID, which was a part of it, and more than just the risk mitigation strategies, but really how to keep yourself safe and how to keep your family safe while you're still doing a good job. So we're really proud of that program. Also with that Frontline Nursing Continuing Education Program, we were able to offer a podcast with monthly episodes for 12 months. And our podcast was able to be downloaded more than 3,600 times by people around the world. And so you'll see, yes, 90% of the downloads came from North America, but really we have a global impact here. Based on the lessons learned from Frontline Nursing over that year, we thought we could make an impact on our local nurses too. So we found from our outcomes that absolutely nurses need this help and they're hungry for this information and they want these resources. So we took it the next step and determined an academic practice partnership that was formal between the South Florida College of Nursing and Sarasota Memorial Healthcare System. And what we did was we put together a program that focuses on recruitment, retention, and well-being for our nursing students and for our clinical nurses at the hospital setting. So our recruitment retention program is offered to our nursing students and is helping build the pipeline into the hospital setting. Our well-being program is offered to the students and the clinical nurses, and it offers them small group coaching, in addition to some education and skill building. And so we are piloting this. We've concluded our pilot with the students and we're evaluating our data. Our nursing pilot will be done in about 6 weeks. And what we're looking at is the impact of this program on burnout, retention, and turnover. And so here's my contact information. And I think I will open it up to questions.
Yeah.
Thank you.
Thank you. Thank you very much. So in the few minutes we have left, why don't we open up to questions from the floor? Anybody? Yes, sir.
Another question then. Do you look to the World Health Organization or the CDC to drive home ESG initiatives, or do they come, independently of those organizations, and how often do you rely on them to get up-to-date information, particularly as it relates to the ESG initiatives?
So I would say a little of everything, okay, a little of everything. You know, certainly during the pandemic, and mainly because I think in general, folks don't have a good tolerance for ambiguity. I would say that to our students. I would say this is going to test your tolerance for ambiguity. The CDC had a back and fill on some of their recommendations. And it, you know, it by and large depends, but in many institutions, there's very strong expertise. And folks are developing this expertise. So for example, within environmental, I'll use that as an example. We've got a lot of things going on in the social arena. Some of our junior faculty have educated themselves and participated in a number of conferences. So they are bringing things back to our institution. Big things and small things, things for the health system, things for us as well. So one of the things, and I feel very bad and guilty here drinking from this bottle, but it was what was offered, and I appreciate having the water. But we have a green committee that's driven by our students. Faculty supervise, the faculty assist them. And the students complained about the plastics in our servery, plastic utensils. We were generating a lot of plastic waste. So we bought, the school bought every student a set of bamboo utensils that are reusable. Okay, that's a small example, but every little bit helps. The same thing with trays that are used in the operating room for procedures. There was a time that those trays, and you'll remember this, Rayna, there was a time that they were covered with a towel that was washable, reusable. Then they went to a plastic cover on them. So we've had trouble convincing the health system to get away from that and go back to the older use. But what our students did was they take these and now they sew sleeping bags for homeless persons out of these plastic tray covers. So they've been working on that as a project to reuse these plastic covers, and they distribute them through our street medicine program. So those are two small examples, not big grandiose things, but I think two small examples where at a grassroots level a difference can be made.
Any other questions? Bill?
Thank you, Peter. Thank you very much for the presentation. Could you speak to what I understand? Thank you, Joe. What I understand to be the crisis in nursing in terms of the turnover, and much of this post-pandemic, but maybe for your respective institutions or any national statistics that you could address. Thank you.
So, thank you. Our crisis in nursing right now is that we don't have enough nurses. So I'm sure everybody has heard of the nursing shortage. And knowing our population that is growing, and we saw one of the graphs that has it's just a sharp spike at the end of the graph. The population is not only growing, but their needs are growing. The complexity of comorbidities, the disease processes, the intensity needs more nurses to be able to care for these people. We have a lot of complexity, though, related to the nursing shortage because we have more vacancies in certain areas and certain settings than others. So it definitely is not the same throughout different regions throughout the country.
So did you want to comment?
So, you know, there's so to chime in with Rayna's comment, you know, it's very distressing. The nursing shortage is extremely distressing and pervasive nationally. Our region is certainly experiencing it. And one of the solutions to the physician shortage has been to talk about nursing providers and having them practice to the limit of their license. But I'm not sure if we're producing enough nurses anyway. So I think that this is a major challenge. Workforce needs are going to be a major challenge. I always think, who will care for us? Who will care for patients during the next epidemic, pandemic outbreak, or just in routine practice? You know, this is, I think, one of the largest threats to healthcare delivery currently.
Thank you. I'm going to take the prerogative of the moderator and ask one final question because I think we're up against it now. Do you have, I want to talk about infrastructure of ESG. How have you implemented this? Do you have an ESG committee? Has the institution come up with protocols or policies around ESG? Is it a centralized effort, a decentralized effort? What is the best way to identify where you want to go and how to roll it out from an organizational perspective?
So I will tell you that we do have formal committees at universities throughout Florida that focus on this. And in honesty, we could do better in nursing. It's not part of our nursing curriculum. It's not a requirement that nursing students are learning about this and learning our role in it. So I definitely think there's opportunity for improvement within our profession and our college of nursing. So that's my strength.
So at our school, so we're a relatively small school. We have about 450 students. We have about 800 faculty, all in, including clinical faculty. And we're an asset of Rowan University, but we have a private hospital system that's our major partner. So our system is a bit fragmented in that regard. We are doing a lot in the social space. But we are also moving into the environmental space. So we have a group of faculty that are charged with ensuring that our curriculum has concepts embedded in a longitudinal manner, not one and done, but embedded throughout all 4 years of the curriculum that address these key environmental concerns, so that we do prepare the next group of healthcare leaders to address them. But we have a long way to go with regard to a more centralized system.
Well, thank you. Please join me in thanking our speakers.